Good morning and welcome to the January 2025 board meeting held in public of the NHS Sussex Integrated Care Board, or NHS Sussex as we prefer to call ourselves. My name is Stephen Lightfoot, I'm the chair of the board, and we're holding our meeting today in Lewes. Now, by way of introduction, I'd just like to remind everyone that this is a board meeting held in public and it is not a public meeting. Members of the public can attend this meeting as observers, and we do have some with us here today. But it does mean that we'll only be taking questions from our board members during the meeting, although I will provide an opportunity for the board to answer any pre-submitted questions from the public on topics related to today's agenda before we close the meeting today. Now, I do need to also make you aware that we are recording the meeting so we can publish a video on our website so that the public, our stakeholders and our staff can see how we perform our responsibilities. Now, before we go any further, I would just like to provide an update on our Chief Executive, Adam Doyle. Now, over the last couple of years, Adam has been spending most and part of his time working on assignment for NHS England in his role as the National Director for System Development. And that workload has been increasing to quite a great extent recently. To such an extent, in fact, that NHS England have asked Adam to work in that role on a full-time basis from the 13th of January earlier this year. So, using our board succession plan, which our remuneration committee has certainly supported us with, I was able to appoint Mark Smith, and we'll introduce Mark in a moment, as the Interim Chief Executive Officer, and Indiana Pierce as the Interim Chief People Officer from the 13th of January as well, to make sure we could maintain our continuity of system leadership, particularly at this particular critical period of the year. I would like to record my sincere thanks to Adam for everything he has done for the Sussex system over the last 8 years, but also to wish him very well in his new role, and also for Mark and Indy for agreeing to step up into their new roles as well. So, with that in mind, I'd just like to go around the table and ask everyone to introduce themselves with their name and their job role for the benefit of everyone watching so that everyone can see who we are. So, as I said, my name is Stephen Lightfoot and I'm the chair of NHS Sussex.
Good morning all, my name is Mark Smith, I'm the Interim Chief Executive.
Good morning, Dr. James Ramsey, Chief Medical Officer for NHS Sussex.
Good morning, Dr. Regarajan, GP Partner Member for NHS Sussex.
Morning everyone, Mark Stainton, Director of Adult Social Care and Health with East Sussex County Council and the Adult Social Care Partner Member on this board.
Good morning, Faustina Bayo. I'm the Non-Executive Director, NHS Sussex, and Chair of the Remuneration Committee.
Good morning, I'm Amy Gallagher, Chief Integration and Primary Care Officer for NHS Sussex.
Good morning, I'm Vince Clark, I'm the Interim Director of Children's Services for West Sussex County Council, and I'm the Children's Partner on the board.
Good morning, Alison Cavan, the Chief Nursing Officer.
I'm Kerry O'Flynn, taking the minutes.
Cassandra Knowles, a Freedom Speaker of the MD for NHS Sussex.
Good morning, Michaela Hawkes, Head of Primary Care Transformation for NHS Sussex.
Hello, Siobhan Melia, Chief Executive at Sussex Community, NHS Foundation Trust and Provider CEO Partner on the board.
Hi, Claudia Griffiths, Chief Delivery and Strategy Officer for NHS Sussex.
Good morning, Monica Fletcher, Non-Exec Director for NHS Sussex.
Caroline Bass, Interim Director of Public Health for Brighton and Hove City Council, and I'm the Partner Member for Public Health on the board.
Good morning, I'm Rahul Jaitley. I'm the Non-Executive Director at NHS Sussex and Chair of the People and Digital Committee.
Good morning, I'm Hannah Hamilton, Chief Finance Officer at NHS Sussex.
Good morning, I'm Jane Padmore. I'm the Chief Executive at Sussex Partnership NHS Foundation Trust, and I'm the Partner Member for Mental Health.
Good morning, I'm Anthony Shipley, and I'm the Interim Company Secretary for NHS Sussex.
Well, thank you, colleagues, and I think it shows a vast array of talents and expertise around the table. But I would like just to record in the minutes, please, Kerry, a very warm welcome as well to Tony Shipley as our Interim Company Secretary, to Vince Clark. I think this is your first role in a public board meeting as the Director of Children's Services Partner Member, and also to Siobhan Melia in your role as the new NHS Trust Partner Member on our board. So welcome to each and all. In terms of apologies, unfortunately sickness and flu seems to have hit some of our members. So we've actually got, unfortunately, apologies from Indiana Pierce, from Louise Ansari, from Paul King, and also Sue Marshall. So having said that, I can confirm that our board is still quorate and we're still in a position where we can make decisions today. But we certainly wish our colleagues well who are not feeling very good today. If we just move on to the items in the board pack, and first of all go to page number 7, we've got the declarations of interest listed out there. Can I just check if there are any new declarations of interest that are not recorded in the register or could impact on any of the agenda items on today's agenda? Not seeing anyone coming forward. Having considered the declarations against the agenda before the meeting, I've come to the conclusion that all the interests are manageable and that we don't need to take any mitigating actions such as asking anyone to leave the room for a particular item. Can I just check that the board is content with that?
Yeah.
Yep, I'm seeing agreement around the table on that one. Okay, so if we can just please record in the minutes that there's no new declarations and the board is happy to proceed on that basis. Okay, if we move on then to page number 12, we've got the minutes of the last meeting from the 27th of November that was held over in Billingshurst. Can I just first of all ask if these draft minutes are an accurate record of that meeting?
Yes.
Again, I'm seeing nods around the table, so I think on that basis, can we just record in the minutes, please, that those minutes are approved? And then on page 27, we have got the action log, which is actually picks up actions from the last meeting, but also previous meetings that were not closed. So that's on page number 27. There's a total of 3 that are still being progressed, and there's 9 actions proposed for closure. Can I just ask if the board is content with that proposal? Not seeing anyone disagree. So on that basis, let's please just note in the minutes that the action log has been approved, Kerry. Thank you very much. And just before we move off the last meeting, can I just check if there are any other matters arising that have not been raised either in the minutes or the action logs from the last meeting that anyone wants to raise? No. Okay. Right, well, let's move on with this agenda then, please. And let's go straight into page number 32, our first substantive item, the Chief Executive's report. And what are the current issues that need to be highlighted for the board's attention? Mark, over to you.
Thank you, Stephen, and thank you, colleagues. It's a pleasure to be here. So, when I was writing this report, and indeed the comments that I was going to make this morning, I was thinking very much it's Oscars season, and I don't want to make my acceptance speech too big, but I just did want to say a massive thank you for the opportunity with regards to taking on this role on an interim basis. You know, it's a huge privilege to lead this organisation and across the system with regards to health and care provision for our residents of Sussex, of which, of course, I am one. So I have a very vested interest in ensuring that we do as best as we can with the resources obviously available to us. Similar to Stephen, I'd just obviously like to thank Adam for his time here while he was at NHS Sussex, and more specifically during the beginning of January in terms of the handover between he and I, to make sure that that was sufficient and prepared me well for this role. It's been really great over the last couple of weeks with regards to meeting partners. I know I still have a number to meet with, but it's been really fantastic just to meet and to equally receive the support from colleagues with regards to how we drive our ambitions together with regards to our Delivering Improving Lives Together strategy, and we'll continue to do that. I think it's really important also to recognise the organisation. So as NHS Sussex, I've had so many messages of congratulations and welcome, and I've been really appreciative of those. And long may those continue in terms of us working together collaboratively and collectively to deliver what we set out to do as an organisation. And finally, on the thank you element, I couldn't not thank the senior leadership team of the organisation. So the senior leadership team more broadly, but also the executive team around the table and indeed board colleagues for welcoming me into the appointment, but also working with me so well in the first couple of weeks in role. There were a couple of things then in NHS Sussex I'd just like to draw up from my report if possible. And the first one, which pertains to obviously an item that's coming up on our agenda with regards to Freedom to Speak Up, which is why I have Cassandra and Michaela with us this morning. But within NHS Sussex, as you can see within the content of the report, it's really important that we continue to listen to one another with regards to colleagues' experiences of work in the organisation or indeed the health and care that they receive. And I'm particularly pleased to reference the workforce race equality and workforce disability equality standards improvements that we have achieved in our time over the course of the last couple of years. I appreciate, as all colleagues would know, that I would say we have some way to go. We would like that number to be 1 in terms of everybody has a fair and equal opportunity, but we have taken considerable action over the course of the last year, which we also have to acknowledge was to really challenging circumstances for NHS Sussex as an organisation in terms of our running cost allocation reductions and reorganising ourselves to be the strategic commissioners that we wish to be moving forward. So a huge thank you to colleagues referenced within the document, but also in our wider staff network community. You know, there's been a huge effort. This has not been by luck. This has been by receiving feedback, listening to colleagues' desires and suggestions, and taking those forward. So a huge thank you in that particular space. I couldn't present this report without talking about winter. Clearly, it's been a topic on the forefront of all of our minds over the last couple of weeks and months, and there's been a huge amount of activity, which obviously Claudia presented at our last board in November with regards to our winter plan. It's really important that we make sure we plan as early as possible to put interventions in place to try and support our population and indeed our workforce to manage during these really difficult times of service pressure. One of the really key elements of that has, of course, been our vaccination programme, and it's been really good to see where we started from to where we are now in terms of the huge improvements in our vaccination rates within our community, but acknowledging that we also have more work to do as we go through 2025 with regards to our colleagues who work in health and social care in terms of vaccination moving forward too. That's going to be really important. And the report articulates our reset programme. So a programme, again, that we set up in advance. This was a proactive as opposed to a reactive step, acknowledging that winter was going to be pressurised for us. And it was really pleasing how all partners came together to support, as I say, what was a really difficult and challenged period of time. I know this personally, as I say, as a resident. My mother-in-law was taken unwell in between the Christmas and New Year period. And whilst we waited, the care and treatment that was received was fantastic. It's just that waiting element that we continue to work on, ensuring that people get as timely a treatment and care as they possibly can. And that all comes down to the value of partnership working, and in that spirit too, also in the content of the report. On my very first day, I was privileged in this role to talk to our Hospice Alliance across Sussex with regards to how we can work in partnership with colleagues across the system to provide as seamless care pathways as possible, and in the hospice sector at particularly challenging times for patients, obviously in their last days of life in some occasions, but also for family members. And I really appreciated my ability to work in the voluntary sector on that first weekend with regards to listening to people's and families' patients' experience of the hospice care in which they've received, and how sometimes from an NHS perspective, certainly it can feel that we might get overburdensome in terms of some of the hospice care and treatment, and we need to respect our position and indeed that of the hospice sector in taking that forward, and we'll continue that work in the coming weeks and months too. Just further with regards to partnerships, and what I was really pleased is in terms of our Worthing Integrated Care Centre and the opening of that in December. We still have services moving there together, but clearly that's hugely in line with our ambitions around improving Lives Together strategy of care coordination in one place for our communities. And as we see, we will have further services joining over the next couple of weeks, which will be phenomenal for the residents of Worthing in terms of being able to access and receive the care which they are entitled to and absolutely deserve. There's a huge amount in the report. I appreciate that. It's a very long report, but a huge amount of thought goes into it. I know that. I knew that when Adam was obviously collating it. I know that when I have been collating it over the coming weeks in preparation for today. And we will cover a number of items contained within the report during the business of this meeting. But I did just want to finish on some of the service visits that we as a team have been able to undertake over the last couple of weeks. And I know and appreciate we have further visits coming up to services in Lewes just this afternoon. But they do provide such a valuable insight into the services provision that we have, the services that we've commissioned, how we commission them, and also the ideas and suggestions that colleagues can give us in those services as to how things can be different. You know, if I just go back to our board meeting at the end of November, of course, Jane, Claudia and I had the privilege of going to the Glebe surgery in Storrington and just seeing the co-location of pharmaceutical services with the general practice services all in one place. Very much beneficial for the patients and residents of that particular geography, but also the move to the new building and how more efficient and effective that building can be than the previous historic estate that we know those colleagues are working within, but we know that that is still rife within our county, and we need to continue to support people in that space. Had the privilege also of attending the Unscheduled Care Hub, which again is referenced as I went through the ball pack more and more today in terms of a real idea of transformation and innovation in terms of how we can avoid patients being conveyed into emergency care settings when we have other commissioned services available for them to utilise across the county. And Stephen was with me along with Alison on those particular visits, and just watching literally live the ambulance stack and calls that were coming in and how those patients were being treated and managed in a different way as opposed to the A&E departments was fantastic. Of course, people will still need to use and utilise urgent and emergency care pathways into an A&E department, but there is alternative commission services available. It's just a case of knowing where they are and how to access them, which is what that hub does. And finally, my visit to Eastbourne District General Hospital the week before last was really insightful. Of course, looking at the urgent and emergency care pathway, just making sure that our winter plans were being held up and were resilient in that space, but also the opportunity to visit their cardio cath labs and to see their expansion into a third lab that they are looking to achieve in the coming years. It then led me to think quite heavily, and I know colleagues who work in the organisation know that I placed this in my report to the organisation 2 weeks ago, that we're going to have some of these defining choices to make, and James's paper on cardiovascular disease later in our board agenda talks exactly to that, which is coordinate with the government's direction of travel. The left shift, as it's known within the NHS, or the prevention agenda, is going to be so very important and vital, because we have choices to make. So we can invest in acute care capacity in order to treat conditions when they arise, or we can try to prevent them as early as possible, and that's the content of our discussion later this morning, straight this afternoon. So other than that, I know it's a huge report. I just wanted to summarise at that stage there, Chair, and ask if there are any questions.
Great. Well, thank you, Mark. And as you say, there's a lot of content in there. But I think actually it's always hard to pull out individuals, but I think actually there's a couple of individuals mentioned in Mark's report that I think we should record our congratulations in the minutes for, and that's obviously for Dr. Mark Gaffney, who won a national award as GP of the Year. And also Lola Banjoko, one of our deputy directors in our organisation, who's also received a national award as Mentor of the Year. And I think actually we should just send our board's congratulations to those two individuals as well. But okay, colleagues, so Mark's given us an overview. So any particular comments? Rahul, why don't we start with you?
Thank you, Chair, and thank you for the report, Mark. You mentioned about the unscheduled care navigation hubs being set up, and I'm wondering how we collect that data and how that might influence the ICTs, the integrated care teams, being put in place to avoid admissions within hospital settings, as well as look at what services make sense to procure locally for the various regions we operate in.
Thank you, Rahul. So as I say, the unscheduled care hubs, I'll get it one day right. I think they're really important, and it's important to say also, whilst they're an innovation in Sussex, this is from a model within our partners in Kent and Medway, in terms of a trialled and tested methodology around reducing ambulance conveyances and alternative care settings and indeed provision. What was fantastic to see, as I say, what I saw there live was a number of clinicians working together in order to make decisions for patients, with patients, whilst attending them, or indeed as they had called the department at that particular time. What it enlightened me was too, and I know Hannah will tell us this on a frequent basis, we commission a lot of activity in urgent and emergency care pathways to such an extent that I believe we may have got it to a position where it can be confusing for a patient to say, where do I go for this particular situation or indeed condition? And therefore the default potential is 999 111 in terms of, that I'll go there, they'll give me the advice and guidance, and I'll go wherever is necessary from that particular position. Obviously in positions of extremists that doesn't happen, you go to 999. But what that then told me about our integrated community teams and how we work with those is I believe we've got all of the services commissioned that we need to utilise. It's just about how we place them local to the community and how people are aware of them and how to access them with ease. I think that's one of I don't have to categorise in all the whole human race, but that is one of our things in terms of human behaviour, is where can we go to get what we need as quick as we can get it, and that is an aspect around some of our communications in the ICTs.
Okay, Claudia, do you want to come in on that particular point as well?
Yeah, so the unscheduled care navigation hubs are collecting all the data, and we can see the breakdown of where the conveyances, where the paramedics use alternative pathways. So I think when we look at the December data, we had 506 multidisciplinary team conversations supporting paramedics, and of those 325 were referred into alternative services to ED. A significant amount going to the UCR type pathways, but we are collecting all of the data so that we can see those flows, and then that gives us a good idea of either where do we have capacity constraints and where might we need to increase the capacity, or to Mark's point, where do we just have a kind of, we don't quite have the pathways working correctly and we need to look at better join up. But it is proving effective, and I think our clinicians are really enjoying working in that multidisciplinary team way to find solutions.
And just to translate that for members of the public, UEC we talk about is urgent and emergency care, and UCR is urgent community response. So just to be really clear about that. So, but I think actually the fact that we're able to reduce the conveyances to hospital emergency departments by more than half in those pilot examples is a very good indication of the impact that this can have. So the people that need the care get it. Okay, Festina, I think you had a question.
Thank you, Mark. And One of the areas that I was excited to see is the increase in GPs in the last 2 years across Sussex, which is great. And in the spirit of sort of long-term sustainability, I was wondering how those 148 GPs and the workforce are being monitored for retention and career satisfaction, and how those GPs are involved in the feedback loop for continuous improvement.
Thank you, Christine. That's a great question. And to be honest, because there was so much I could have discussed, I didn't discuss that particular element because in our later item on the people plan, we have Dr. Laura Bell attending to talk about exactly that. But it's a really great question in terms of it's not just a case of attracting or educating people into the sector, it's a case of how do we maintain and retain them, and based on feedback, as your question rightly points to. So we have the Primary Care Workforce Improvement Group and a Primary Care Workforce Plan, and we have Lara as our clinical lead in that particular space, along with the Primary Care Workforce team here to do exactly that. It's really important for us to understand how colleagues are feeling and what the impacts of some decisions that they make or we make or indeed maybe made nationally are impacting upon their ability to deliver care, and then what can we do about that? Yes, that's a great question.
Okay, well, let's pick that up
Yeah.
during the people plan as well, because I think it's a highly relevant question. So, okay, colleagues, anyone else wants to ask anything? Yeah, come on.
Yes, thank you. Something you mentioned in here, which as a resident of Sussex, I didn't see anything from the perspective of the population, but it's a really interesting thing. Can you tell me anything about the success or not of Let's Get You Home for Sussex campaign that was launched on the 13th of December? It sounds like a great idea. You go onto the website, there's lots of information, but how did this get out? And was there any, can you give me any feedback as to whether that was a success, or how do we measure success?
Thank you, Ron. So it's a great question. That's exactly what we're trying to work for at the moment. I look at Claudia because she's right next to you, edging to come in as the lead for the campaign. Yeah, so, well, and I didn't want necessarily to do that because it's my report and so I should own it. But the credit where credit's due, the leader of that campaign is right next to you in terms of the evaluation piece and indeed the piece around communication. So Claudia?
Yeah, there is. We did it as part of the winter reset. The Let's Get You Home campaign was the communications element of that, to really support our public, patients, their families, but also staff to understand what are the different routes that we can use and what's the support that's in place to facilitate people to be discharged more quickly. So what we can see in looking at the data is we did see a significant improvement in the rate of discharges in the run up to Christmas, and we hit the 92% occupancy target that we were aiming for between the Christmas and New Year period. The challenge is maintaining that outside of those periods, but I think it has surfaced some helpful points for us to look to build on, to make sure that people really are aware of all of the support that's out there. And that's not just patients and their families, that's staff that are on the wards as well, understanding what voluntary sector type support is also out there. So my team are working through all of the data, and what we do every year through the winter programme is do that lessons learned piece and do the analysis to understand which are the interventions that worked and we should roll out more broadly, and which are the ones that weren't so successful and we might need to look at an alternative approach. So a report typically comes back. I'm trying to think about the timing. I think it's typically in about May time. We usually do a kind of winter learning type paper that comes through. It'll go through our integrated assurance group and into EXCO that does that whole analysis. We typically take that through the hospice as well.
Oh, great, thank you. And that would include vaccinations and
absolutely
in there as well. Thank you.
And that'll probably then lead into the planning for next year.
Yes, absolutely.
Of course, you see. So,
Yeah.
but Mark Stainton, obviously Director of Adult Social Services, you know, the social care sector has obviously been involved in the discharge programme as well. Just from your perspective, anything else you want to add to what Claudia said?
Nothing significant. I think it's really hard to identify one single element and then measure the impact that that single element has had. But there's no doubt that the Let's Get You Home campaign has been a really useful part of the menu of discharge activity. As Claudia says, you know, raising awareness and expectations for patients, their family members, but also the staff across health care and the voluntary sector, as to the drive to get people home or out of the acute setting as soon as possible. I don't envy Claudia trying to pick out which bit of the menu has had the best effect, because you know our experience is it's all goes into the mix about that concerted effort to facilitate discharge.
Yeah.
Could I just come back very quickly?
Please.
It's just, I think the website and the information on here is absolutely amazing. It's just how do we get that more sort of people aware of that?
Yeah.
So there's probably a bit more to be done on comms maybe this year. Excellent work. So thank you, what he said.
Yeah, well, it impacts on not just the patients but also their families as well, of course,
Yeah.
and especially a special time like Christmas for many people. Okay, colleagues. So if there's no other questions, Mark will just thank you for your report, and as a board we're asked to note it. So on that basis, Kerry, can we just please note that the board is content? Thank you very much for that.